Thompson. I will be going through the class today. This is a very hot topic. The gut is one of my favorite topics to talk about, so I try to stay very focused and on task in trying to stick with my presentation because it is, for me, a very fun topic. I should start off by letting you know that this is for educational purposes only. It is not meant to take the place of any advice of your physician. I often tell people I don't make friends with your physicians by teaching classes like this, and I understand that and deal with that, so that is fine. So feel free, hey, I went to this class and I learned this information and now what? And you know, I'll get the backlash and that's okay. Primarily the information that you see in these presentations, this particular one, a lot of information coming from the Institute for Functional Medicine, Metagenics, as well as the Integrative Healthcare Symposium. So a variety of places, just in case I fail to put on a slide where the information came from. So a few things about me. I am the owner of HealthyTransformations, which is located in Washington Mills, New Hartford area. I do have my master's in applied clinical nutrition. Recently received the national certification, which is a certified nutrition specialist designation, which was quite extensive and a long period of time and cost just a ridiculous amount of money just so I can put CNS after my name. But hey, you do what you have to. I am also a life coach and a lifestyle educator. So all of these things, as you can imagine, just kind of come together under one umbrella. I do teach here, obviously, at MVCC for non-credit classes, but I do also teach in their nutrition program here, as well as the medical program at Utica School of Commerce. So it's fun to work with up-and-comings who are very interested in this field as well. My son is a 20-year-old who's off studying in Denmark this semester that I just kind of live through his fun and excitement while I do all the working so he can be having fun and excitement in his life. So just a little bit about me. One of the things you'll see up here in terms of a functional nutritionist, and I had mentioned that a lot of information coming from the Institute for Functional Medicine. My training really has been primarily not only in the world of nutrition, but in this field of functional medicine, meaning that essentially what we do is we look at the why of a disease. So traditional medicine is really trying to tell you what's wrong with you, and functional medicine wants to know why it's wrong with you, so we can fix it. You know, I often tell people, I really don't care what your diagnosis is. I want to know what system's being affected so I can get you better. So as we talk about the gut, this is one of those systems. So you'll see we're going to talk about a lot of things like GERD or IBS and irritable bowel disease and bloating and constipation and diarrhea. These all fall under the whole gastrointestinal system. And the goal is to fix that rather than say, well, you have IBS. I'm sorry, there's not much we can do for you. You know, this is kind of what happens. Or here, you have GERD, why don't you take Nexium? Or take proton pump inhibitors of some sort for the rest of your life and still not feel good, right? I see some nods going, yep, that's why I'm here. Right? So the ultimate goal in functional medicine is to figure out the why. You're actually right on the cusp of, I just came back from a conference from last week, and there were some fantastic speakers on the gut, so I was able to pull in just a few more extra things into the class with trying to stay within my time limit here, just on some more recent information that has just come out. So in terms of what you can expect today, we're going to go over a little bit about the basic biology of the gut. I think it's very important for you to understand what's actually happening in there, because knowledge is power, and the more you know what's going on there, I think the more likely you are to do some fixing of it. Of course, we're going to talk about some of the diseases associated with this system, and obviously nutrients and foods that will help to actually heal you. This is not something most people have to live with forever and ever and ever, which is nice. And then certainly we'll have some time for questions. I put this up sort of joking, but sort of not. I told you it's a hot topic for me, so I will be watching my time, and by all means, if you have to leave a little early or you know it's getting to that time where class should be ending, feel free to just get up and go. I get it. If you want to stick around for questions, by all means, I will stay here. So one of the things in functional medicine, and this is also true with naturopathic medicine, if you're familiar with a naturopathic doctor at all, is the concept that death begins in the colon. Has anybody heard that phrase before? No? quite an old phrase, actually. Death begins in the colon. Naturopathic medicine always says, when in doubt, treat the gut. If you don't know where to go, if you're not really sure what the cause of any problem is, go to the gut. Because most of the time, when the gut is healthy, the rest of the body will be. And it really comes down to the basic biology of what makes up this whole system. The whole concept that everything we come in contact with has to go through our digestive system. From what we're breathing, it all gets absorbed here, right? It all starts right in here. Everything we eat starts in the mouth, has to go through the system, and we'll decide, is it friend or foe? What are we going to do with it? Right? So really the health of your GI system really can be a determining factor to how healthy the rest of your body is, and certainly when it comes to immune health. Everybody familiar that most of your immune system, the reports vary, about 80% of your immune system or your immune cells are found in your gut lining. So if you're getting sick quite often, it's usually a gut issue because your immune system's coming from there. So this concept of death begins in the colon is this idea of, bottom line, not letting everything build up there. That's like just a toxic dump, essentially. And this is a good sign of what's really going on in the body is basic bowel movements, for lack of better words. So just to kind of put in perspective, I know this comes up a little fuzzy, but just to kind of give you an idea when we're talking about the GI system and referring to it as the gut, I mean, it's just the term. It's so much easier to say that than gastrointestinal system. But it's all starting with the mouth. This is the first point of digestion, is the mouth. And you don't have to admit to it, but a lot of people do the 1-2 gulp, I call it, where we don't chew our food, right? I didn't get too many nods, but I know you're out there. The 1-2 gulp, we might chew a few times and then you can literally see food like going down your throat and you're like, right? We don't take the time to even start the digestion process off right, and we think somehow our body is supposed to be able to handle that. So ultimately, we're starting with the mouth. We deal with everything, obviously, with the esophagus. You come down to the stomach. Does everybody realize your stomach's really sitting about here? Right? This is really where your stomach is. So I oftentimes, when I'm working with anybody, when they say, oh, my stomach hurts, where? Oh, my stomach, it really hurts down here, my stomach, all the time. That's not your stomach. Your stomach is here, but we tend to just use that phrase all the time, right? So your stomach actually is very tiny, but we do this wonderful thing, especially in America, of overeating, so we make it expand, right? So the stomach is actually quite tiny, and its job really is to help break foods down. So the whole goal is that we chew the food up nice, it's all mush before we swallow. It gets to the stomach, and now the acid of the stomach can start to break food down further into its usable form. Contrary to what some people believe, chicken is, the body is not really using chicken. It's using the amino acids that you would get from chicken. And until that body has amino acids, it has no idea what chicken is. It's not a usable form. It needs to be broken down, and that's part of the goal of the stomach. The stomach, as everybody knows, is pretty acidic. Right? And the whole goal is to do that. Now, one of the things that the stomach also does is, because it's so acidic, is it helps to kill bacteria. Right? So part of that is having enough stomach acid to kill off all the bad stuff associated with foods. For instance, if anybody likes to eat sushi, it's raw fish, right? We've got to be able to kill off bacteria associated with it, and part of that starts with the acid in the stomach. Actually, it really starts with the mouth, but moving into the stomach to help kill that bacteria so it doesn't infiltrate the body. So we start with really poor chewing is one of the first problems when it comes to digestion. But then the next one, and very common, and we're going to talk a lot about the stomach today, is this idea that your stomach is too acidic. And I'm going to change your thoughts a little bit, and you're going to probably walk away and realize that you actually don't have enough acid in your stomach to actually break food down properly. And this is where very typical symptoms of GERD, bloating, heartburn, things of this nature come into play. From the stomach, of course, we also have part of our system here, the liver and pancreas, or excuse me, the liver and gallbladder. And the liver is really, we talked quite in depth at the last class about the liver and its role with detoxification. But the liver really is a big, I always say it's a big chunk of real estate in the body. It's a really big organ. It takes up quite a bit of space here. And it plays a lot of important roles, including detoxification, but it is considered really part of your gastrointestinal tract and part of the digestion process. Certainly the gallbladder, I hope everybody has one here. It's there for a reason. The gallbladder plays a huge role in to help you break down fats properly. So when we remove them, it's a really bad idea for gut health. And a lot of people get them removed. It's kind of just fun now to do. Like, oh, you might have gallstones, let's remove it. Oh, you had an attack, let's remove it. So the gallbladder is really important. It produces bile, which allows the body to break fat down. So without it, guess what? You don't break fat down. Now some people would think that's a good thing. That's a bad thing. Your body needs fat from good beneficial fats. So not being able to break it down properly then means you can't use fat properly. So that's a problem. And then you have your small intestine and your large intestine, also known as your colon. So the small intestine is really the site where all of your nutrients are absorbed. Big site for this. This is really, really important. Now, if food is getting into the small intestine in too large of particles because you didn't chew it right or your stomach didn't make enough acid to break it down further, bloating occurs really quickly too. So if one of your symptoms is that you bloat within about 30 minutes after eating, your small intestine is struggling with the whole concept of not chewing food properly, the stomach not breaking things down right, and now it's just putting pressure on everything. And then, of course, the last step of it is the large intestine, the colon, and this is ultimately where the whole job here is to rid the body of waste. The problem is a lot of people deal with chronic constipation, which then you just have toxins literally just sitting there, essentially poisoning you by just sitting there in your large intestine. So one of the things that's very important is that your GI health actually begins at birth. So a little bit, just bear with me here in the importance of this. When a baby is born, their GI tract is really sterile. So they are very susceptible to everything they come in contact with. So one of the things that's really important is this is where vaginal deliveries play a huge role, is that helps to colonize the GI system because they're naturally exposed to bacteria of the mother. And this is also why breastfeeding is important, especially in the first few days. Very minimally, I would encourage women to at least breastfeed for the first 3 days when colostrum is present, and antibodies are very, very rich in the colostrum along with fat to really help establish a baby's GI tract, okay? Without that, it's sterile. It doesn't have those good bugs in there to help fight off and help to develop the immunity that's needed. So this really is super important, the first few days. Essentially, we have about 100 trillion bacteria in our gut. There is more bacteria living in your gut than you have cells in your body. Is that kind of cool? I think it is. I mean, there's more, really it's the bacteria that rules you. We are just here. Bacteria is really what we're made up of because there's more bacteria than there is us, ultimately. I just kind of think it's neat. It's about half the volume of the whole GI tract are these good living bugs, or what should be good living bugs there, that's really keeping your system healthy and vibrant. A few facts, basically, as we talked about. Anybody want to take a guess where digestion really begins? In the mouth. Anybody else? Saliva. When? So what are you doing at that point? Yeah, so what's really working? Your brain. Your knife and fork. That's true. Your brain is actually working. This is actually the true first part of digestion, is the brain and its association to food and or the event around food. So just to give an example, you're going, I'll use me. I won't pick on you, I'll pick on me. Going to my mother's house, and I know she's going to make this great dinner that you can only have at mom's house because nobody knows this recipe other than her, right? And you're thinking about that and you know it beforehand. You're in anticipation of having that meal. So really, it's almost like you can taste it and smell it before you even get there because the brain's working. So this can be a good or bad thing, right? If the brain's working and you're thinking about it and you're associating good feelings with it, then you're going to sit down and really enjoy the meal. Or if the brain's working in a negative way, oh my God, I got to go to mom's and eat dinner. I really don't want to be there. It's going to just be a nightmare. She's not going to have anything I want anyway, right? You can see how this can work both positively and negatively based on the mental state that you're in. So has anybody eaten under stress before? Never, right? Never happens. Do you ever feel like you really digested food well? Or can you almost just feel it like sitting there, right? When you're under an extreme amount of stress. Because digestion is really beginning in the brain. So really food in your digestion process is affected by what your mood is. What's your anxiety level? What's the anticipation behind it? Some other things, thinking about what the taste or the appearance of food is. Have you ever just had a plate put in front of you and you're like, ooh, no, that just looks gross, and your appetite literally, you could go from ravishing hungry to completely turned off. Or you could see somebody's plate over there and like, ooh, that looks really good. And all of a sudden you're feeling hunger for something even though you just ate, right? And unfortunately, usually it's the bad stuff. You pass by somebody's office and they got donuts or cookies or candy or something like that out that triggers a whole negative response. So there's a lot of things that really affect it, and it all starts with the brain. So one thing that I would challenge all of you to do is to stop and think and become more aware of your eating habits. Are you in front of the TV when you're eating? Are you in the car when you're eating? Are you at your desk just answering emails while you're eating? Because it's really set the wrong stage for proper digestion to take place. So this is some of the newer research that was actually just came out. You can see most of this here as early as just October of 2012. 60 to 7 million people having some sort of diagnosable digestive disorder. That's a lot of people. And again, this is traditional medicine focusing in on the diagnosis. 236,000 or so have died from a digestive disease of some sort, whatever that may be. 14 million end up in the hospital every year, and about 105 million are the reason for an outpatient visit to the hospital in terms of a GI complaint. So this is quite broad. It could be everything from, you know, constipation to, as you can see, even up there from cancers associated to the GI tract. So essentially, bottom line is a ton of people are dealing with a digestive disorder, right? Somebody you know is dealing with this. Essentially, about $40 billion a year from our health care is spent on digestive issues alone. Quite a huge amount. So again, one of the things, just to talk a little bit further in detail about how this all works. One of the posters that you have in your handout, actually the only poster you have in your handout there, is I'm taking bits and pieces from that poster, and that's what you're seeing up here. It's called Intestinal Health. These are my good and evil posters. Everybody's collected some of these through other classes. So you can see that one side of the digestive tract here, that's the good side, and then we have the evil side that's over here. For obvious reasons, the intestinal wall should really look like this. It should be nice and plump. It should have a nice color to it. You can see, you can see that there's these good little bacteria. They're really the tiny ones there. And you got a few stragglers, a few big ones. That would be normal. You're not going to be 100% good bacteria in the gut, because at some point some bad guys are going to get in there, but the good ones are going to overtake them. And you can really see it's nice and thick. Ultimately, if you could show it on a picture, it'd be nice, it'd have a nice mucus to it, a little slimy type of situation going on. Versus the bad side, you can see there's creaks and crevices in it. It's overtaken with the bad guys. You've got a lot of those white ones there. That's probably candida or yeast that's been forming. And ultimately, what it's leading to is a lot of different disorders. Everything from indigestion to your GERD, diarrhea, constipation, your irritable bowel syndrome, just general inflammation in the gut overall. So it's all really, we're looking here to figure out how healthy is this system really. And I would tell you, for most people, everybody's got a little bit of an issue going on here. There's not many people who are really great here, unless, of course, you've been doing your healthy stuff for quite some time and have had time to restore. One of the things I do want to point out, and it's easier to see on your poster than it is necessarily up here, but back here you start to see all these little projections, these little villi sticking up. And that's present throughout your whole digestive system, especially within the intestines, these little villi. We're going to talk a little bit more about those later, but just to give you an idea of what I'm talking about when you see them here. And also the concept, has anybody heard the term leaky gut? Couple? Sounds gross, doesn't it? Leaky gut, like what is it spilling out? Kind of. I mean, it kind of is. It sounds very disgusting because it really is kind of a disgusting process. But a lot of people are walking around with that. And that's where we're talking about on this bad side here. You got all your creaks and crevices going on. And essentially what's happening is that food, essentially, or different bacteria, different toxins, all of that, is able to literally leak through your intestinal wall instead of being absorbed. And then it gets out into your system, primarily your immune system, and it goes on attack because it sees something as being foreign. And we're going to talk a little bit more about that too, but just to give you an idea when we're referencing to the poster, the little villi and these little cracks that allow that leaky gut to take place. Some of the complexity behind it is, as we talked about, always there's inflammation present. If the gut's not working right, there's some sort of inflammation present. A lot of times there's that overgrowth of bacteria, and it could be anything from yeast to just a combination of bad bugs to parasites. Some people don't want to hear that, but I do have to say I saved you from a really awful slide that they decided to share. I was kind of tempted to put it up just because I was so grossed out by it, I thought other people should be. In regards to parasites, okay, I'll just leave it at that. It was really gross. It was one of those like, oh, I can't look, oh my God, I can't stop looking. So this can be an issue, but typically there are a few little parasites floating around in everybody. Not that we want to hear that, but we talked a little bit about some of these numbers, but essentially a good majority of people are walking around with some sort of gut dysfunction, an estimated about 70% of people. It is a very sensitive organ. Okay, so it doesn't take much to really disrupt it. Just as an example, anybody had E. coli? You had the wrong spinach, undercooked chicken, you gone to Mexico and drank the water. You know, little things can really disrupt the GI tract quite quickly. And the normal response would typically be diarrhea, right? That's how the body's getting rid of it. The body knows how to fix itself. Sometimes we just don't allow it to do that. And then we'll take an anti-diarrheal because we don't want that. But the body's trying to rid itself of some sort of bad, toxin or parasite or whatever you might have come in contact with, because it can be quite sensitive, because it's really exposed to a lot. Ultimately, GI disruption can lead to a lot of other clinical issues. So when I say that, knowing that, again, everything starts and ends with this whole system. So we know that your immune system's found in the GI tract. So if you start to think about all of the diseases associated with your immune system, every autoimmune disease out there, you can take hypothyroidism. Hashimoto's thyroiditis is an autoimmune. Lupus is an autoimmune. Arthritis is autoimmune. Rheumatoid arthritis is an example of that. Irritable bowel diseases like Crohn's and ulcerative colitis. These are all autoimmune diseases. So your immune system's being attacked, right? But it's starting because of dysfunction in the gut. So going back to the whole naturopathic idea, when in doubt, treat the gut. Because when that's fixed, a lot of other things balance themselves. To go back to the liver, and just a little bit of a recap from our class before about the liver, hormones all get filtered through the liver, starting with cholesterol being the master hormone. So you can start with thinking about the digestive tract and cholesterol levels. And when we're talking about all hormones, I'm talking about things like insulin and cortisol, which are our stress hormone, and our reproductive hormones. So cycles can be off, libido can be low, any sort of sexual dysfunctions, and it's all because something's going on in the gut. Now, you don't typically go to your gastroenterologist and say, you know what, my libido is really low and I'm having major hot flashes. What can we do about it? Right? You go to your OBGYN, and they're not making the connection. So this is where functional medicine works a little differently with that. So there's a lot of information here. Oftentimes, and I talked about a bunch of these things here, a lot of times the GI function won't necessarily present itself as a GI disorder. So sometimes people will come in, I'll use a perfect example of this, depression. Now, some of you who are in my class might have heard me say this already, but depression, if somebody came to me with depression, what are you typically thinking of? The brain, right? Something's going on with the brain. You need some sort of antidepressant. SSRIs is the class of drugs we love giving people. But actually, serotonin, which is our calming neurotransmitter, is primarily made in the gut. So depression's a gut issue. I see some faces going, really? I don't think this chick knows what she's talking about. Serotonin is primarily made in the gut. So if somebody comes in with depression, I say, how are your bowel movements? You know, and I get that look like, what do you mean, how are my bowel movements? How are they? Oh, I go every 4 days. Surprise, surprise, right? Do you drink water? No, I hate water. You have any fiber? I don't know. Does a Big Mac have one? You know, things like that. So depression could be one of those things. That's the symptom that's showing up, but the dysfunction's actually occurring inside the gut. So there's a lot of things that will show up in those fashions. Some other symptoms that come up, think about the inflammation. So this concept of leaky gut, that you're going to hear me say this a lot. So inflammation, and I'm not talking about inflammation, you fall down, twist your ankle, and it gets inflamed. That's an acute inflammation. I'm talking more systemic inflammation. So any of the itises, arthritis, rheumatoid arthritis, osteoarthritis, anything that has itis associated to it, that type of inflammation that's going on, might really be caused from that leaky gut syndrome. It's this intestinal impermeability, it's known as, where things are just getting out into the immune system that shouldn't be there, so your body's doing what it should do, which is to fight off the invader. And if you're fighting off the invader, inflammation is present. That's part of the process. So your body is actually doing what it's supposed to do. I think this is a neat concept because we don't listen to what our body's trying to tell us. And traditional medicine will say, well, here, you need this NSAID. You know, you need this anti-inflammatory. You know, or you need this drug for it. Well, the question is, why is it there? Because the body's really doing what it needs to do. It's inflamed for a reason. Now, what is the reason? What is it trying to fight off? Dysbiosis is just kind of an imbalance, essentially, between your whole gut and immune system. But some of the other things that we're going to talk about in terms of IBS and IBD and things of that nature. And as I mentioned, rheumatoid arthritis is a big one. So what contributes to this? How does somebody get leaky gut? Do you have leaky gut? You're probably all sitting there going like, are they things like just leaking out right now? Probably. You're in the gut class. So probably, right? One of the big ones is NSAID use. NSAIDs are your things like Advil, Aleve, these non-steroidal, I forget, anti-inflammatory something or others, right? So NSAIDs are very commonly used. They are popped like candy. Has anybody ever read the bottle of Advil? Anybody got some on them? If you actually read the bottle of Advil, you would never take it. Honestly, pick it up next time you're in the grocery store or drugstore and look at its use and look at its warnings. Ulcers, internal bleeding. There are more people that die from NSAID use every year. It's like 107,000 people from using it properly as prescribed. Now, if you think about all these people who are like overdosing, I mean, there's people who take it daily, whether to calm inflammation, for a headache, whatever it is. But this is part of the problem that actually leads to leaky gut because it's literally destroying your gut. It eats away at it. That's why one of the side effects is ulcers. It's eaten away at the internal lining of your gut. So one of the very first things, if you are on NSAID use, time to get off of it. Time to switch. Time to find an alternative. That alone could be the thing that helps heal your gut up. That alone. Same thing with the proton pump inhibitors. Everybody familiar with what those are? PPIs? PPIs include things like Prilosec, Nexium, Acifex. You know, now you can get everything over the counter, Protonix. These all fall into that proton pump inhibitor class of drugs. These rank as one of my top despised drugs out there because of how they work. They actually, as the name implies, they inhibit this proton pump from working, which is found in the stomach. It literally tells your stomach to stop producing acid. That's its job. It tells the stomach, stop producing acid. Okay, so then everyone thinks like, oh, well, see, I don't have any heartburn now. I can't even say everybody, because a lot of people are on these and still have a lot of heartburn because we're using them improperly. But so we stop off the production of acid in the stomach. Now, if we just kind of go back and think about the stomach is responsible for producing acid to break food down. So if we don't break food down properly in the stomach, it's going to travel through your GI system and put the burden on all of these other organs that are not meant to break the food down that way. So now we have further GI distress. Proton pump inhibitors are also the leading contributing factor to having low B vitamins, especially your B12 and folic acid, because that's where it comes from. Your ability to utilize B12 happens in the gut, or excuse me, in the stomach. And when we shut them off with proton pump inhibitors, we now see signs of vitamin B deficiency, like cardiovascular disease. So cardiovascular disease is the symptom that's showing up, but the issue starts in your stomach. This is how this stuff happens. Guess what? Depression too, vitamin B deficiency. So maybe the proton pump inhibitors are working in that fashion. Just trying to help kind of put the pieces together. And this is complex, and a lot of you are hearing stuff going, are you kidding me? How come nobody ever tells me this stuff? I hear that all the time. Well, I don't know. That's why I'm here. Like I said, I don't make friends in the medical community a lot of times with this information. Proton pump inhibitors, research indicates it is used temporarily, 4 to 8 weeks. That is all it's approved for. I have a client who topped the records at 22 years on a proton pump inhibitor. And guess what they were coming to me for? GERD! I was like, let me think about this. It doesn't work, but yet you still take it every single day for 22 years. Yep, well, my doctor told me I needed it, and if I go off of it, I'll feel even worse. Well, you can't feel any worse than having all the GERD symptoms that you have. I mean, what are you going to feel? GERD times 2? I mean, what's going to happen? Right? 4 to 8 weeks is its approved use. And again, this is about reading your insert. Anybody read the insert of your drugs if you take them? Good. Scary, exactly. That's an understatement. That's an understatement. I've had people come in and say, you know, I'm taking so-and-so. Do you know anything about it? And I will literally just pull it up on the internet, go to my database and pull it up, and here's your printout. And it's like, oh my goodness, nobody told me this. Well, they kind of did by giving you the printout. You know, we're supposed to read them. Nobody wants to, but that's what we're supposed to do is read them. Antibiotics are another big contributing factor. Anybody been on antibiotics? Ha, ha, ha. right? Like at some point, any time in your life, have you been on an antibiotic? It destroys your gut. One time, one use. So I don't care if you were 2 years old the first time you had one and the only time you had one. It destroyed your gut lining at that point. Now what about the chronic use of them? This is always fun. Oh, you got a cold. Here, take this antibiotic. What? Yep. 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 For acne, definitely. They're used really, they're getting a little better, I do have to say. A lot of doctors are getting a little bit better about using them, but we're still way over prescribing these things. So antibiotics, they are against the bacteria, right? They go in there to kill off something bad, right? You have some sort of bug, you have a virus, whatever it is, they give you an antibiotic to kill off the bad, right? Except it kills off the good. It doesn't differentiate between the two, it just kills off all of the bacteria. And do they ever tell you, take a probiotic with this? Maybe some doctors will. Most won't. They won't tell you for a while afterwards, you're going to want to repopulate that gut with the good bacteria, all 100 trillion of them that make up your body. You want to repopulate that so you can feel well. Antibiotics are a huge contributor to a lot of gut issues. So again, you can start just thinking about, if you're on any of these, it's time to kind of go, what can we get away from? And that might start to do the healing process. Obviously, poor diet is a big contributor. You know, the body's not really meant to absorb and digest Big Macs and French fries and a Slurpee, or whatever they're called, big gulps, right? You know, these supersized everything. It's too much, it's way too much burden on the digestive tract. And of course, it's just loaded with a bunch of bad stuff that the body really can't utilize, so it gets stored as fat and, you know, all that fun stuff. Stress, as we talked about, your mental state plays a big role. You know, have a nice sit-down meal with somebody versus a heated argument at dinner and see how well you feel. It will totally change your digestion. And then there certainly can be some sort of pathogenic type of issue going on with some sort of organism or infection that you just might not know about. Just a low grade, it's not necessarily making you feel bad or good, it's just there. It could be something that happens after you've traveled overseas and you come back and you've picked something up and it's disrupted that gut bacteria or that ecology in the gut. So there's a lot of reasons for it. These are 3 big ones, followed by the diet and stress. But typical use, sometimes we just need to look at drugs that are being taken and say, is my symptom associated to the drug I'm taking? Because this is how we get on that polypharmacy trend. You take one thing and it creates an issue, so then we take another thing for that issue. And then the 2 of them together create another issue, so we take something for that. Now we're up to 3. Before you know it, you come in and you got a list this long, and you feel like absolute garbage, right? It's what happens. So looking at this is going back to your poster there. When I was talking about those little villi, I just want to talk a little bit about how they work. So this is just a different snapshot into it. So we're talking about these little projections that stick up, these little finger-like projections. This is what they look like. So they kind of have this nice little wavy thing. The whole goal with these little villi is that they're responsible for nutrient absorption. That's what they're there. They're like these little fingers, little antennae that are just out going, hey, I'm looking for vitamin C, and where's my vitamin E, and let me grab that calcium. And that's just kind of what it's doing, is they're out there floating looking for those nutrients. They're very fluid. They're waving around just so they can collect everything. And if we go in a little further and just look at one of them here, very blood dependent. You can see there's veins, arteries going there. So there's a constant blood supply going on. So we need nutrients to basically keep them healthy. But ultimately, if anybody's here wondering about celiac disease or potential of that, ultimately what celiac disease is, these little villi, these little finger-like projections have been worn down. So for visuals, I like visuals. Instead of a shag carpet, you got a Berber rug. Okay? Got that, right? It's easy to picture. So celiac disease is when you've got a Berber rug. It's gone. Those little villi have been worn down after typically about a 7 to 10 year time period of exposure to gluten. So the only thing that a celiac patient can do is be on a very strict gluten-free diet. The intestinal wall has been destroyed. It's worn down, you got a Berber carpet, it's been walked over too many times, there's no bringing it back. That's all there is to it. Now, a lot of doctors are testing for celiac disease, and they're telling people, you don't have celiac. Good. You don't want to get there. There's a big difference, though, between a shag carpet and a Berber carpet, right? There's a lot of in-betweens, a lot of variations. You ever have a carpet where, you know, it's been walked over a little bit and then you vacuum it and it kind of fluffs back up? That's your intestinal wall. Once you get down to where it's all completely worn out, there's no bringing it back, though. Right? So there's a lot of in-between with that villi. So you don't want the celiac disease to say, maybe I should avoid gluten, because there's a lot of in-between. Because that gluten is really one of the contributing factors to what wears these little finger-like projections down. So, you know, they're out there waving and they're all happy, and then they're not waving so much and less and less and less and less until they're here. And that typical time frame is between 7 and 10 years for a diagnosis. Not because you've been misdiagnosed, but because it took that long for the actual wearing to get down to the point that you could be diagnosed. All diseases don't just show up overnight, yes? Oh. Yeah, you know, diseases don't just show up overnight. You know, it's not like today I don't have celiac and tomorrow I do. There's a lot of signs and symptoms in between. So, but this is where the absorption really of your nutrients is taking place. So it becomes super important there. Essentially where food is hanging out, just to give you an idea of overall transit time, it should be about a minute in the mouth. Try it. Let me know. Shoot me an email, tell me how long it was really in your mouth. You'll be like, oh my gosh, it was there for 2 seconds. Pay attention, it's kind of a fun experiment. Chew, 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 chew. It should be mush in your mouth before you swallow. So of course it's going to take you a little longer to chew chicken than it would a banana, right? But it should still be mush before you swallow. So about a minute there, 3 to 12 seconds traveling through the esophagus, and then about 2 to 4 hours in the stomach. So it takes quite a while for all that churning to go on in the stomach to really break foods down into proper utilization, really, of the nutrients. Okay, so you take chicken, and chicken has to break down into amino acids. That's what the body really uses, or is the protein from it. About 5 to 6 hours in the small intestine, where the primary absorption is taking place, and then about 12 to 24 hours in the large intestine. So guess what? You can figure this out if this is working for you. And one of the sheets that you have there is called a colon transit time. So this is what you're all going to do. You can pull your sheet out if you want. You're all going to do this. You're going to have a fun experiment and get your family to do it too. Why not? Typically, you're going to use corn. You can use corn or beets. Corn, I think, is a little easier. Sometimes with beets, you know, the stool's going to turn red, and then some people think they're bleeding, and they freak out a little bit. So use corn, about 3/4 of a cup of corn. And on that sheet, you're going to write down when you had it. So let's just say you decide to have it for dinner tomorrow at 6 o'clock. Now, everybody knows, right? When you eat corn, what happens? It comes right back out. This is why we use it. Okay, so you have about 3/4 of a cup of it. Write down the time you ate it. Then write down the first time you see it in your stool and the last time you see it in your stool. And we'll get an idea of how long food is taking to get through your system. In particular, how long is it sitting in your large intestine? If it's more than 24 hours, it is sitting too long. Colon's not evacuating properly. Okay, it's kind of a fun test. And I say that because I've had people call me after 4 days and say, I haven't seen the corn yet. Okay. Did you go to the bathroom? Uh-huh. Oh my, we're really full of it, for sure. Literally. Because it's taking that long to get through the system. It's backed up somewhere, right? It's taking that long. So it's a quick, easy way to figure out how quickly are things moving through. This is a very good indication just to see where might the potential issues be. So if it's coming out in 12 to 24 hours, colon's probably not the issue. You're really moving things along properly there. right? And if it's that, you go to the bathroom every 9 days, well, then we know that's a problem too, right? Because it's supposed to be 12 to 24 hours. Everybody know proper bowel habits? Go 3 times a day? I always get one of those faces. What? Are you kidding me? 3 times a day. If you ever want to know how the body actually works, pay attention to a baby. Babies do everything right. They breathe right, they eat right, they sleep right, they poop right. They eat, they poop. They eat, they poop. They eat, they poop. That's what you're supposed to do. So 3 times a day would be about normal. You should eat and poop. You got to get rid of the stuff that's not needed, right? Breathing. Babies breathe through their belly. We talked about this we didn't do stress management this time. That was the last class. But stress management, one of the best ways to calm stress is to do belly breathing. Has everybody heard that term before? You let your belly expand and contract. Babies do that all the time. And guess what? They're chill. They're like, hey, who cares? Is it time to eat? Time to poop? Which one? Right? Their bellies are just expanding and contracting. So they really have it right. So this comes down to it. So your goal, everybody's goal is to be able to poop 3 times a day. Okay? You will love it when you do that. Really. I have people call me up, yeah, I got there. It's really a great relief for people who are dealing with digestive issues. You feel so much better. So this is the concept of normal intestinal permeability, or somebody who doesn't have leaky gut. Okay? You can see here, this is just a lining of your cells. And just to give you an idea here, these are in between the cells. It's this idea, it's called tight junctions. So as the name implies, these cells are held together really tightly, so things can't get through. Okay, so these different things that come through here, we'll just call them different foods and toxins and things of that nature. They can't get through here. They're too big, and that junction is too tight together. So it stays in the intestine where it's supposed to be until it can get properly broken down into a smaller, digestible, usable form. With leaky gut, you can see what happens here. It's expanded out. So instead of being together like this, it's expanded out. And now we allow and have room for things to permeate, essentially. And remember that some of the things that are causing that are your antibiotics or certain drugs like the NSAIDs and that. And it causes those cells to come apart. And now these food pieces and toxins and such can actually leak through. So why is that important? Why am I spending so much time talking about that? What is the point? The whole goal here is that you're never going to fix anything until you bring those cells back together. So you can stop that leaky gut from happening. And this is largely dependent on diet. That's why I'm focused in on it. That's why we're talking about it. So all these things they come through that cell wall and then they enter the bloodstream. Hence why things like your immune system and all of these things go on attack. Because there's these things floating around that aren't supposed to be there. Okay? When it comes to overall the gut barrier, essentially you go through the digestion process, and ultimately what happens is it puts a lot of strain on the liver. So again, I probably did these a little backwards because we should have done this one first, then the liver class. But I did the liver last time. But essentially the liver then has a whole bunch of activation that goes on that essentially tells the body about inflammation. And it can tell some localized inflammation, such as your knee joint, or you can just be systemic inflammation, such as an autoimmune disease, like a hypothyroidism is an example. So it's all going back, though, to this guy right here. That's the real issue that's stemming this whole process to be able to even take place. So who would think that your knee pain has anything to do with your gut? You know, but that's partly where it's starting from. Some other things that have been associated to it. Obesity. So many people, I think Bob was the only one here for the last time. The last gut class we did, a young girl had been to multiple doctors, got all kinds of testing done, and basically kept coming up empty-handed. So she took this class, and I challenged her a little bit to do a few of my suggestions here. And she came back for the next class, which was the gluten class, which was going to follow this class next week. And I swear I did not pay her. I simply told her, try this, see what happens. She came back, I'm not even sure it was actually 2 weeks later. And not only did she have no symptoms, I mean her bloating and constipation, all that was resolved in a couple weeks. She had lost, I think, like 8 pounds because she got rid of stuff that didn't belong there. So obesity, I mean, well, you might not think about that, but obesity is associated to your gut health. So if it's poor, you might be overweight or obese. Alcoholic liver disease in general associated to it. Inflammatory bowel disease, diabetes, fatigue. These can all be associated to it. The general guideline when it comes to this, as you're going to hear me talk about, is gluten is a huge contributor. Now some people are going, I knew she was going to tell me something I didn't want to hear. I don't really want to give up gluten. But gluten is a huge underlying factor. Gluten is this great mimicker of being able to look like a lot of other things in your body and really can wreak havoc on the body. And leaky gut, pulling in, this is from 2009, but the leaky gut due to gluten intolerance being associated to autoimmune disease, being the contributing factor. I put some of this in here for the simple fact that I want you all to know I don't make this stuff up, and this isn't just coming from the journals of nutrition. This is coming from the journals that your doctor should be reading. So, you know, sometimes when there's question, they need to read a little bit more, right? One of these things here, a proton pump inhibitor. People who are on proton pump inhibitors, I just want you to see, they have more bacterial infections. So you're on a proton pump inhibitor to hopefully help your gut feel better, and you're actually creating more bacterial infections because you've turned off the acid production in your stomach. And the acid is supposed to help fight off bacteria. So now you don't have GERD anymore, you don't have heartburn anymore, but now you have chronic candida or yeast infections. That's your trade-off because you got more bacteria going on. Fun stuff, right? Do you see why I like the gut? Anybody see? I really, so many things get fixed with this one. SIBO, has anybody heard of that? Small intestinal bacterial overgrowth. SIBO. Yeah, SIBO is quite common and quite prevalent. Just as the name implies, small intestine, that's where it's taking place, and it's a bacterial overgrowth. There's just too much of the bad guys floating around there. And it's causing a lot of issues for a lot of people. And a simple breath test can determine if you have this. They look for the alcohols that come out from the breath test. So any gastrointestinal doctor should be able to do this for you. Do you have SIBO? Better yet, do you get bloated after you eat carbohydrates? Almost immediately. If the answer is yes, chances are you have SIBO. That's a really easy test to do. Okay? Again, this is in terms of PPI therapy. So your proton pump inhibitors may promote SIBO. So once again, you don't have heartburn, but now you have small intestinal bacterial overgrowth. This is what I find fascinating about the drug world, is that you take care of one gastric problem to cause another one. Awesome. This is just mind-blowing, really. Antacids. People who pop those Tums like mad. Or better yet, take Tums as a calcium supplement. Women, if your doctors ever tell you that, please don't do it. There's much better sources of calcium out there than Tums. Okay? So antacids, they neutralize stomach acid, right? That's what they do. That's how they work. So they calm that whole process down. But overuse of them will cause things like diarrhea and constipation. So once again, we've created another problem. We're fixing one to create another. IBS is a big one. Big, big, big. A lot of people coming in complaining about IBS. About 75% of people doing some sort of treatment for it. This is largely, I will tell you, this is my, yes, it's talked about, but in my practice, personally, what I see, IBS is more about the stress connection in food than it is about dysfunction in the gut. The gut could be okay, but it is the stress connection to when you're eating or thinking about doing something. I had a woman who the only time her IBS flared was every morning that she had to go to work. Weekends didn't bother her. Vacations didn't bother her. Didn't have to go in, didn't bother her. That wasn't food related, right? That was stress related. Soon as she started thinking about getting in the car to go to work, she would have a sudden urge to go to the bathroom. That's not gut dysfunction, that's stress, right? And a lot of IBS is that, and that's where people who have the IBS, now you've gotten the diagnosis of IBS, but you don't really have a therapy that's working for you because we're not addressing the real issue, which is the stress connection to the GI tract. And most of the time, 75% of those people who are taking some sort of conventional therapy are having still symptoms. 22 years on a PPI and coming in to see me for GERD. That's what's happening. A lot of people are doing that. This is actually just some new information that, again, I just took from the Integrative Health Symposium that came up. Women are more prone to it. I know you're roasting back there, aren't you? It's pretty warm in here. Women are more prone to gut issues, in particular even IBS, to be more particular. 2 to 3 times more likely, first of all, to seek out help than men. Sorry, men. Women just ask. Men don't. They deal with it a little bit more frequently. But there is a huge connection that, look at that, what influences it? Estrogen and progesterone. How many women get PMS and beforehand their PMS includes constipation or diarrhea or increased hunger? There's a reason. It has to do with digestion and your digestive health. So some of these things show up because there's a connection between the two. So women are more likely to because we have higher levels of estrogen and progesterone, which are influencing it. This is a fun one. Can everybody see that? I'm afraid your irritable bowel syndrome has progressed. You now have furious and vindictive bowel syndrome. Hey, it's fun. Not really, not for those who are dealing with it, but come on. Some of the approaches to it. IBS definitely can be modified with lifestyle things. And here's some of them. First and foremost, eat and chew well. Right? Just slow the process down when it comes to this. Avoiding certain sensitivities or food triggers. Now, this can be difficult for a lot of people in trying to figure out what your food triggers are. This is where having a diet diary really helps. A lot of people hate writing down what they eat. They find it very just annoying. But this is the best way to figure it out, because I have no clue what I had last Thursday. I mean, if you do, more power to you. Let alone 2 weeks ago, to know what your symptoms might be associated. So this is one of the best ways to figure out those food triggers, is to be writing things down. Dietary fiber is needed to help lessen the blow of IBS. So fiber is coming primarily from your fruits, vegetables, and legumes, which people just typically aren't eating enough of. Drinking water certainly can help. Everybody drink 8 glasses a day? Yes, no, maybe?
Does it make a difference if it's seltzer water?
It does. So carbonation actually neutralizes the stomach acid. So, seltzer water, sodas, I just kind of saw, really? Yeah, carbonation actually tells your stomach to stop producing acid, which is why a lot of people, like when they eat the Big Mac and follow it with a soda, they're like, oh man, that Big Mac really bothered me. No, it's the soda that you told the stomach to stop producing the acid so it couldn't digest the Big Mac that you just ate. So any sort of carbonation will change the acidity of the stomach. It's actually best when you're eating to have liquids completely away from a meal. So again, you know what? Elderly do this right. I watch my grandmother. She doesn't drink anything with her meal. And I always wondered, how do you do that? But, you know, over time, she's just gotten to that point. A lot of elderly do not drink with their meal, and that's one of the best things for digestion, is to not have fluids with a meal. So 30 minutes before, 30 minutes after is a general rule of thumb. Did you have a question?
Yeah, baking soda in water, can that help?
It will help to calm things down. Yep. Did you have a question?
No, I heard that too.
Oh, okay. Yeah. Yeah. So really, obviously, drinking water is going to help because of bowel movements. So with IBS, it's going to help overall with bowel movements. When you have fiber present, sometimes people will eat fiber or have a more fibrous diet or even take a supplement, and now they're feeling some discomfort and gas or bloating and things of that nature. Fiber by itself, just sitting there, is going to cause those things because you need water to allow that fiber to expand so the colon will actually eliminate. So if you're having a large amount of fiber without water, chances are you're going to have some symptoms of gas and bloating, discomfort in the absence of water. So water becomes super important for just another reason. Eating slowly, reducing your stress, exercise. Getting out and moving after a meal will aid in digestion. It will get things moving along much better and going through the process right. So sometimes after eating, people just want to lay down and chill out, and that's the worst thing to do. The absolute worst thing. Get out and move. It will totally help things go along. And if needed, supplementation can come into play. Typically with IBS, I don't see as much of a need for supplementation because it is more of a lifestyle issue. With GERD, you're going to see a lot of similarity across the board in terms of recommendations and treatments for GERD. Avoiding trigger foods again. So what are some of the big foods with GERD that you might be familiar with to avoid? Spicy. Chocolate. Coffee. What was that? Oh, I thought I heard another one. So these are some of your big triggers. And obviously, if there's a food that is your own specific trigger as well. Small, frequent meals, so you're not trying to digest too much at once, is going to help. So on top of being a great way to boost your metabolism, it's also a great way to help in the digestion process. Look, chew your food again, have some water. You might need some supplementation to actually heal the esophagus lining. Zinc carnosine is a fantastic healer. It's called the natural purple pill, zinc carnosine. I can't remember if that's in here somewhere or not. You can call that your natural purple pill to help heal up that esophagus lining in particular. It's beneficial for the whole gut lining, but really good for the esophagus. Uh-huh.
How long should it take to heal?
8 to 12 weeks.
Okay, well, I've had repeated strokes and the same diagnosis all the time, and I don't eat spicy food.
Have you taken, the zinc?
No.
8 to 12 weeks with zinc carnosine. So let me preface by that. It should be 8 to 12 weeks with the proper nutrient supplementation there. 8 to 12 weeks. And you've never been told that. And this is on my end, one of the very frustrating things in my world is that sometimes it is the simplest of fixes and you just don't know it. And you go back and it's constant irritation. Yep. I hear it all the time. Why didn't my doctor tell me? I don't know. Not your doctor. I'm not really sure why. Yeah. Even if it doesn't work. Right?
But I take it because I can't see whether I have irritation, and that's why I have to believe them.
Yeah. Yeah, this goes in a little bit to my, as I call it, my God complex. That oftentimes, and it's through really nobody's fault, but we kind of get to this point of like, it's the doctor. He's my doctor. I'm going to believe him. You've got to put trust in your doctor. But sometimes we put a little too much blinded trust in them. And my dad always says, Kim, somebody finished at the bottom of their class, and they still got MD after their name. Right? I mean, that's the truth. Somebody just squeaked by, but they passed the test and they got MD. We have this misconception that because they're a doctor, they know everything. No, they're human. I mean, come on, it's impossible. It's very difficult to stay on top of the research as well. Very difficult. The amount of emails I get on a daily basis for different subscriptions and different articles and that, it is a full-time job trying to keep up on that. It's very difficult to stay on top of it, especially to stay on top of something that they don't know anything about, which is nutrition. Those are going to really be overlooked. I mean, I weed through stuff because I look for things like the PPIs. I look for things like birth control because these are the things that I see a lot of. So I want to know what the latest is on that. I might not look at the cancer treatments because I don't see that many cancer people. So, it's really difficult to weed through and stay on top of it. But a lot of times, they just don't know. It's not their fault. It's not how they were trained. They weren't trained in this. Bloating. Bloating, I have to say, is one of the biggest concerns that people complain about. And like I said, that SIBO, that small intestinal bacterial overgrowth, if you respond almost immediately to carbohydrates with bloat, chances are that's what's happening for you. So if you can pinpoint it to that. But I love this because this is so true. How many people do that? You don't have to show me by hands, but a lot of people do this. We eat on the run. We eat at our desk. Somehow we think that we're not entitled to a lunch hour anymore, or a lunch half hour, where you're not supposed to be at your desk working. You're supposed to go and sit down and enjoy your meal. Certainly, again, trigger foods can play a role in it as well. Constipation definitely can lead to bloat. Your body's trying to get rid of stuff, and it's not, so it's just expanding in an area that it's sitting there. Overeating. We've kind of done this thing, especially like if you think about Thanksgiving or different parties, like that's a sign of a good meal. Oh man, that was good, right? No. Your body's screaming that you overdid it. That's why you feel so uncomfortable. That was not a sign of a good meal. I don't care how good it tasted. It was not a sign of a good meal when you've gotten to that point of discomfort. Your body basically can't handle it. Bloating, again, stress. You see why I do a stress class too, right? All the connections with stress. There can also be a lack of digestive enzymes. And this can be for a variety of reasons. As we age, digestive enzymes will naturally be produced less and less. Some people just have little variations in their genes that don't allow them to produce as many digestive enzymes. Some people are on digestive enzyme therapy for life. Some people are on it short term until the body gets the signal, like, oh, we're supposed to be making these. Oh, I forgot. I forgot you need these. It's the same thing with your stomach acid. When you've gone through a process of telling the body to stop producing it, whether it be through different drugs, having carbonated beverages when you're eating, things of that nature, the stomach really it's smart. It's really considered, the digestive tract is really considered your second brain. I actually think it's the first. I think it's smarter than our actual brain. It tells the rest of the body a lot of information. But essentially, as it gets that message to stop producing acid, it can also get the message to produce acid. And the easiest way to do that is to supplement with hydrochloric acid. And eventually those cells kind of reawaken and they're like, oh, wait a minute, we're supposed to be doing something here. Vacation's over with. And they will basically get back to doing their job. So sometimes there is that aspect of it. I want to just cover a few myths on digestive. The 5-second rule, who does it? Nobody? Oh, I'm shocked. You're just not admitting. That 5-second rule. No, we shouldn't do it. Men are more likely to do it than women. Go figure. No, I'm just picking on you guys. But ultimately, in that 5-second time frame, up to about 18,000 different bacteria can collect on that food. How crazy is that? Even more crazy that some scientists out there researched it. 5 seconds, quick, how much is on there? Right? So the 5-second rule is not a good thing. This is so important just in the overall standpoint of thinking about not indicating that anybody that doesn't keep a clean house, but I certainly don't clean my house daily. I don't have the time. Do your best, right? Make sure the counters are cleaned and things like that, but there's still bacteria all over the place. So there is general exposure in what we're exposed to. How about antibacterial soaps? Yes, use them? No, no, don't use them? I got a few more no's. Anybody else? Anybody else have an opinion? I got 1 yes and 3 no's. Okay, I'll give you my opinion. No. No, 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 no. This has contributed so much to our immune system shutting down. We sanitize everything to death, literally. Antibacterial soaps, we put those in, antibacterial sprays, antibacterial lotion, antibacterial this, the little hand sanitizers are all over the place in the schools. They're all over the place in hospitals. Before they came out, you know what we used to do? We used to eat dirt, and we lived, and we lived pretty healthy. because we got all this good bacteria from the dirt. Now we're so busy sanitizing everything that our immune system doesn't learn how to fight anything off. Has no clue. Sanitize, sanitize, sanitize. We need to come in contact with certain things. Touch stuff. Ooh, there's some germs on here. Immune system, do your job. Because whatever is on here, it's in small amounts. Now my immune system can do its job and fight it off. So next time I come in contact with it, it's not a problem. Does that make sense? I hate hand sanitizers with a passion, along with the antibacterial soaps for this reason. Good old soap and water does wonders. This is one of my favorite little tidbits. Having small bacterial overgrowth can show up as if you've been drinking on a breathalyzer test. You get pulled over, you breathe into that little thing, but sir, I haven't been drinking. Because of the ethanol that this bacteria produces, it will show up as if you've had an alcoholic drink. Interesting. So what's going on in the body with all of that ethanol being produced? Puts a lot of burden on that liver. It's like you're constantly in buzzed mode. I won't say full out intoxicated, but you got a little buzz going on all the time with that production of ethanol that comes from the bacteria. My last little myth, are all probiotics the same? No, not even close. There's all kinds of probiotics out there. We're going to talk a little bit more about them. But just to give you an idea of the snapshot into some of them. These are all the different types of, not all of them, some of the different types of strains when it comes to probiotics. And they all do different things. So to give you an example, Saccharomyces boulardii, which is in through here. Saccharomyces boulardii is great for traveler's diarrhea. It is great if you've been on an antibiotic to help with the diarrhea associated to antibiotic use. But when you go up here, you can see your lactobacillus. These are all different lactobacillus species. That's really good for the immune system. Right, you come down some more lactobacillus and bifidus bacteria. That's good for overall balance of the gut. Reducing carcinogens. So having that exposure to certain carcinogens, such as smokers who are getting those toxins. Whole different strains here. So my point in bringing this up is that they are very different. And a lot of times now I think it's great that the media marketing has kind of put it out there about probiotics, like, you know, eat your yogurt. Probiotics, right? What's her name? Jamie Lee Curtis and your Activia, right? Have that and you get your probiotics. Well, kind of. Not quite, but kind of. Yes, probiotics when you make yogurt are in it. Unfortunately, most of the commercial yogurts are so full of sugar that by the time you actually get the yogurt, the bacteria has been killed by the sugar. So you're actually not getting any probiotics in it. There was a really fun study that was done several years back with a probiotic that I use, and they found that you needed 36 tubs of yogurt to equal the one capsule. I don't know which one you want to take. It was actually fun at the time because I made a whole little display of 36 tubs of yogurt, and everyone's like, wow, what's that? That's how much yogurt you need to eat to get your probiotics. So one little tub of it is not really helping you. I don't care what Jamie Lee Curtis has to say. But all of these different strains serve a different purpose. And one of the things is that a lot of probiotics out there will say, oh, it's lactobacillus. Okay, lactobacillus what? It's like saying you have a dog. I don't know, do you have a Chihuahua or a Rottweiler? There's a big difference. I kind of want to know before I come over to pet sit. Right? So just saying that somebody's taking lactobacillus is not very specific enough. So just to give you an idea on probiotics, just word of caution when you're looking for them. So ultimately, what's the real answer? Which is this is what everybody's really here for, but I hope that information helps you get thinking a little bit. Dietary issues, dietary modifications. Having some lifestyle factors like exercise play a role. And then certainly proper supplementation if it's warranted for you. I like to work with food, but a lot of times by the time somebody does come to see me, gut dysfunction is kind of running rampant, and we want to get some relief. So I do use, just so you know, some supplementation from that perspective. One of your handouts is the 5R program. Yeah, I think it just says 5R on the top. I can't remember. So truly, it's from a research standpoint, it's shown as the 4R approach for gut restoration. However, in functional medicine, it's been modified to become the 5R approach because our 5th R is that rebalance, which is stress. So we're going to talk about the first 4 R's to begin with. And the first one being the removal process, second one being replace, third is reinoculate, and fourth is regenerate. So the first one is the removal. So what is it that you need to remove? Now for everybody, this is going to be a little bit different. But the basic way to start with this is doing what's called an elimination diet. Standard elimination diet. You get rid of the common triggers that have been known to be food allergies that might be contributing to your problem. Now that's another one of your handouts. You have it right there in terms of what to avoid and what you should be having. So let's just talk about that a little bit there. Your foods to avoid and foods to include list. These, again, are the top allergenics, one of them being gluten. I find gluten and dairy to be the two biggest contributors. Two biggest contributors to digestive and a lot of other issues going on. But again, some of the things that you'll see avoided on here are also things like soy. Eggs are avoided. Red meat, excuse me, is avoided. You're essentially eating a whole-based diet that is very rich in fiber through your fruits and vegetables. You have good sources of fiber and protein through your legume or your bean family. So things like chickpeas, hummus, black beans, make up a vegetarian chili of sorts. Having poultry and fish rather than red meat. And obviously some of the big things that you're eliminating is the processed foods, the sugars, the artificial food-like substances as they can be known. Anybody read any of Michael Pollan's work? Like Food Rules or Omnivore's Dilemma, anything like that? His book, Food Rules, I swear I wish I came up with this concept because it is the simplest book out there, and I'm sure he's made tons of money off of it. It literally are rules, like, you know, one page is, don't eat anything your grandmother wouldn't recognize as food. Flip. That's one of your food rules, right? Avoid, one of his things is calling it food-like substances. These things that are really not food, we've just created them into food. Like one of the things I think about my grandmother was, you know, those Go-Gurts? They're like in a tube. Like, what on earth is this? Because in a tube is toothpaste, not food, right? We've made up these things that are really not food, but we eat them as if they are. But real food is real food. It's grown, it's flying, it's swimming in the sea, comes from a plant. That's what real food is. So that standard elimination diet is really the first process for everybody from a removal standpoint, is really focusing in on dietarily, what can you get rid of that might be the trigger? And for everybody, it's going to be different. These are just some of the common ones. You could have some very obscure, who would have thought you were allergic to rosemary type of allergy? And I say that because it took me a long time to figure that one out on me. Okay, just some very obscure thing. It just doesn't work for me. Me and rosemary don't get along. We're just not friends, right? But that's not on the list because it's not a common food allergy or a common trigger for people. The other thing is, what else do you have to remove? Is there a bacterial overgrowth? And if so, how are you going to remove it? Well, there's some great herbals out there. Cooking with things like oregano and garlic. Those are antibacterial. Did you know that? You have things right in your kitchen that serve its purpose. Ginger kills bacteria. That's why you actually put it on sushi. Not just because it tastes good with it, but because it kills the bacteria of the raw fish. So there's a lot of herbs that you can use that will help to actually kill off bacteria. Are there certain pathogens? And if that's the case, you've got to really get into some testing with this. You know, unless your doctor has tested for it, you won't typically know this. And a lot of times, you know, this program here will help you rid your body of those bacteria or those pathogens. But sometimes, unfortunately, things like this do need antibiotic therapy, depending on the severity of it. But there are a lot of natural remedies for it as well. There are some great antibacterials out there that are very high dose things of, like I said, the oregano and berberine and different plants that are very effective at killing bacteria. Do you need, yes?
Does peppermint oil help?
That won't help to kill. So it will help to soothe symptoms, but it's not necessarily an antibacterial, the way that things like berberine and oregano are. Maybe you need to remove some acid inhibitors or NSAID use, as we talked about before. So it's looking at that. What are some things that you're taking that might be contributing to the problem? And so some of the things that I had talked about here, these are big ones just for you to know. Garlic and horseradish, oregano, your thyme, lemon balm is another one. Golden seal, these are all very beneficial in helping the removal and the calming process. So using those, just cook with them. At a very minimal, cook with them. And some of these you can get, like a peppermint oil, an essential oil you could get. And a lot of people do just rub the oil right on their stomach area or wherever is needed to help just soothe and calm things down. Oregano oil can also be used in that way. I just warn people, you're going to smell like a pizza place. But it works very effectively to really get right to it. No problem. Have a good one. NSAID use, as I had mentioned, 107 hospitalizations a year. I think I actually said 107,000 deaths earlier, and it's hospitalizations. About 17,000 deaths. Yes, thank you. Yep, I'll be in touch with you. Have a good one. It is the 15th most leading cause of death in the U.S. NSAID use. 15th on the list. How come we're not talking about that? How come it's still sold over the counter? Like anybody could go get it at any time. And I love it because then I'll have people say, you know, I don't know that you should really be on 5,000 units of vitamin D. That might hurt you. But go take an Advil. You'll be all right. Right? Basically, no, the majority of people aren't getting any really reliable sign or symptom that something's gone wrong. And they end up, and usually it's an internal bleed of some sort that occurs as a result of these. So really big on removing this. If you have, obviously you're here, digestive complaints. Get rid of the NSAID use. The replacing phase. So you might need to replace the stomach acid. Instead of taking it away with the PPIs, maybe your stomach acid is too low, and you might need to replace that. Now, there is a simple hydrochloric challenge. I used to bring them to class, and I don't bring them to class anymore because if you are on certain medications or have had a history of ulcers, then you should not complete this test. So I always want to make sure, even though the warnings are on there, I decided not to hand them out anymore until I know you and know that it's okay. But it is a very simple test. You actually take a tablet of hydrochloric acid at the beginning of your meal. And ideally, what should happen is, keeping in mind your stomach is about here. So anywhere between here and the esophagus, you should get an unpleasant, heavy, not quite burning like a heartburn sensation, but that's the best way to describe it. Unpleasant enough, but not debilitating in any sort. That's what the response should be with the use of one of those tablets, and that indicates your stomach is making enough acid. If you feel nothing, which most people do, then at the next time you take 2 of them. And hopefully you get that same uncomfortable response. And then it gives an idea, okay, you're not making enough, but you're pretty close. So you need to supplement just a little. If after 2 you feel nothing, you take 3. And at that point, for me, that's enough where I say, you're just shot. We need to do some supplementation here. We need to get you going again. Some supplements, I will warn you, with hydrochloric acid will tell you to go up to 8. I just find that extreme. I cap it out at 4 because that's even a lot. But at that point, if you really need to take 8 of them, you are severely depleted. And just give your body time to adjust at 4, because taking 8 with every meal is really just a pain, in my opinion. People aren't going to be compliant with that. Who wants to take 8 horse pills at dinner time? Sure. Yep. But you want to do it knowing that you need it, and being careful with that. So you might need to replace the stomach acid. You might need to replace some digestive enzymes. If you've heard of things like, well, a lot of people will take a digestive enzyme when they drink milk, right? They'll take a lactase. Or Beano is a digestive enzyme to help you break down beans when you have that type of fiber, or the beans or vegetables in that fashion. Those are a form of digestive enzymes. Now there's a lot of different products again out there with varieties. So it can be a very basic, or it can get very broad to make sure that you really address every single thing that you could possibly come in contact with. They have some that get very specific now too. Just again, coming off this conference, there was a company there the whole company does just enzymes. That's the only formulas they do. And they got very specific into the dairy and the gluten and the beans and the this and the that. And I don't know, if you don't have digestive enzymes, you just don't have digestive enzymes, get a complete one. Part of this is kind of a trial and error. Do you need it? I particularly look for certain signs and symptoms to determine if somebody really needs it or not. I always, let me preface by saying, always start with the diet alone, because the diet really can fix a lot of things right there. Possible symptoms of low acid. And I want to point this out because these are the same as symptoms of high acid in the stomach. So things like bloating, belching, burning type of sensations. That can be a result of low. Intestinal gas or excess gas in the upper intestine. So where you're kind of feeling that gurgling stuff going on here, or maybe you're even hearing it. So that internal gas in the intestines. Any sort of indigestion or diarrhea, constipation can be associated with low stomach acid. And iron deficiency. If you have anemia, we've got to start thinking about stomach acid. Also a B12 deficiency. That's not up here, but it should be up here. A sense of fullness right after eating, and I mean like almost immediately. Like you fill up really quick. You know, you drink some water and you're like, oh, I'm full. That's a sign of low stomach acid. Just not working right. If you have undigested food in the stool. So some of the questions that I ask people, tell me about your bowel movements. How often do you go? Is there food? Is there mucus? If there's mucus, you're not digesting fats well. If there's food, obviously you're not digesting food well. Shouldn't be there, outside of corn. Do you strain? Does it come easy? Are they formed? These are all indications. There's a great little book. They're little tiny books. What's your poo telling you? I mean, it's a little comical take on it, but it's true in those terms. If you get nausea after taking supplements and or prescriptions, that's usually a sign of low stomach acidity. So there's a lot of different signs that can be associated. But unfortunately, these signs also, when you go to the doctor, they go, ooh, you probably need, you know, Nexium, right? Here's Protonix. Take it daily for 22 years. Call me then and let me know how you're doing. Replacing the digestive enzymes. This is a nice complex where you put the betaine, hydrochloric acid, and pepsin together as a complex. Really just helping overall with that replacement of digestive factors. And then a broad spectrum. There are different spectrums of digestive enzymes. You will find vegetarian-based out there, and you will find some that have animal bases to them. So if you're a vegetarian, know that you can find plant-based digestive enzymes out there if you're looking. Reinoculate. This is the third step. This is usually a pretty important step that I will implement with a lot of people just because most people do need this on some level. This is where we talk about your probiotics and prebiotics. Everybody's heard of probiotics, right? What about prebiotics? No? Yeah, prebiotics are food for probiotics. Right? So probiotics are it's our live bacteria that's in the gut, that's living in our gut. Well, if they're live, they need to feed off something. And primarily it's things like fiber that they feed off of. Another reason why that high fiber diet is good. But probiotics are living being bacteria. So a few things about probiotics. They should be refrigerated, because these bacteria, when they're refrigerated and cold, are essentially dormant. When they heat up, they come to life. That's why they do really well in the digestive tract, because there's a lot of heat there. So they should not be on the shelf, just sitting there at room temperature. I don't care what any supplement company says. If they say that's not true, it's because they want to sell them products that are sitting on a shelf and don't need refrigeration, because there's added costs that go along with that, and having to ship and store and the whole 9 yards. But so they should be refrigerated. There were several studies that have been done on probiotics. Consumer Labs even did one not too long ago that basically showed that all of the bacteria in a lot of your retail brands is just dead. They're gone. They're done. And that...
Excuse me, there's no sense to take a line.
No. Yeah, and Align wasn't one that they looked at, but a few, like there was a Rite Aid brand, a Nature's Way brand, and a few others that essentially when they tested it, it was completely dead. You were taking a capsule full of nothing. And part of that is just the storage process of it. So the rule of thumb when it comes to probiotics too is that when you're looking at it, 15 billion organisms a day is what's actually been studied in terms of being beneficial. That's kind of the gold standard. Now you might see some lesser amounts in things like an infant formula, okay, because you know an infant's 8 pounds. They don't need as much as the 150-pound adult, right? But I can tell you infant formulas that I use still have 10 billion in them. And that's really a very small amount in the big picture of that whole ecology going on. So 15 billion, when you're hearing about the benefits of probiotics, it is based off the 15 billion mark, not the 300 million that might be in an over-the-counter retail brand. Big difference between them, big difference. And they should always be labeled this way, CFUs. That means colony-forming units. If it's in milligrams, they haven't even labeled it right, so it's a good sign not to buy it. Okay? Yogurt's not enough, we talked about that. And then, of course, getting very strain-specific, as we saw on the other slides there. So as a general rule of thumb, you want something that has a mix of lactobacillus and bifidus bacteria. Sometimes you do want, usually with digestion issues, Saccharomyces boulardii is a nice add-on, but the different strains do different things, so don't get so specific that when you buy one that you're only buying one over the other. Lactobacillus, for the most part, is what populates the small intestine. Bifidus bacteria is typically the large intestine, so you want to get both areas. And then prebiotics again are the food that probiotics are feeding off of. So guess what? Probiotics will multiply much quicker if they can eat. You know, and can be fed properly. So fibers. Certain herbs will help. Antioxidants help with this. Cinnamon is really good for this. So sprinkling a little cinnamon on food. And you don't need a lot, just a little. Don't try that whole cinnamon experiment of trying to, you know, has anybody tried that? I've seen it online, but I want to see somebody in person really try that. Does everybody know that experiment? It's like a I don't even know that's a tablespoon, a teaspoon of cinnamon to try to actually eat it. Nobody can. You can't physically get it down. So just a little bit of cinnamon is something that would help. But here's a whole list. So if you want to write some of these down, talk about them. Some of them are listed on your sheet, the 5R sheet. Things like onions come up again. Onions and garlic. Everybody cook with those? Do you know why you cook with them? Huh? Flavoring. That's what we think. They actually serve a purpose. You start with onions and garlic, and they are a great medium for killing bacteria. So by the time you add your chicken into it, or your beef, or whatever it is you're cooking, it helps to kill the bacteria of that raw meat. Who knew? And of course, it adds flavor. Oh, what do I have there? Chinese. I have Chinese something there. I'm not sure what that was supposed to be. Not Chinese food and not the people either. I'm not really sure where I was going with that one. Garlic and leeks, bananas, certain fruits because of the fiber, of course. Soybeans, chives, peas. Some of these have to do with the fiber content and being a little bit more beneficial than other. Your legumes, green tea. Everybody hears about a lot of benefits of green tea. This is just another one of those benefits. It's a great antioxidant. Yes?
What about prunes?
Prunes will help with the fiber. So these are kind of the top in terms of the prebiotics that will really help to fuel the probiotics. Prunes, because of their sugar content, can also allow bad bacteria to grow. So there's a delicate balance that has to happen there. Chicory or chicory root. Has anybody tried tea-chino or heard of it? Anybody trying to get off coffee? Anybody want to try to get off coffee? No way, are you kidding me? Tea-chino is a fake coffee. It actually is made from chicory root. So it's an alternative to coffee. So coffee is a big contributor of gut issues. So for people who don't want to really back away from the coffee, tea-chino is a nice alternative.
I just started drinking it this year.
Did you? Yeah. It's made from chicory root is the main. Oh, okay. Well, get rid of it. Why start now?
I don't know, just to wake up in the morning, I guess.
Oh, Lordy, have an apple. You'll do better with an apple and some water in the morning than the coffee. Yeah. Really kind of neat. Who knew? Same thing in the afternoon. Daytime fatigue, number one reason for daytime fatigue is dehydration. Not because of Dunkin' Donuts needs your $2. Some other things like asparagus, kefir, yogurts. These are all some prebiotics as well. So it really just helps to fuel the body to create more of that good bacteria. Yes? So the elimination diet can be used for more than just GI issues. So again, it's taking away some of the sweetness, but honey is a good prebiotic. It can help some things along. So that's general rules, basically. So I don't get so specific. A lot of times I will really, truly, especially raw, local honey, I usually encourage people to have because it helps the immune system. So some of these things I don't necessarily take away on the elimination diet. If the worst thing you're having is honey on that, I'm okay with that. You know, so. Just a little information. I'm not going to spend too much time on this, but from probiotic standpoint, I bring this up just because this is what a probiotic should really look like in terms of labeling, is that this is a Lactobacillus acidophilus NCFM strain. That's how specific they really should get. There should be almost 3 parts, to them. So Lactobacillus acidophilus is one strain, and NCFM is getting even more specific. So it's like saying you have a pet, you have a dog, you have a Yorkie. Okay? It's just kind of going down that, it's the general, you know, if you remember from elementary school and the genus and species and all of that fun stuff. It's really just breaking it down in that fashion. So you have a pet, you have a dog, you have a Yorkie. That's what you're looking at in identifying this, because these are little live bacteria. So they belong to that whole genus, species, you know, that whole biology standpoint as well. And this I did also put up here because this is actually the strain that has been established as being the gold standard out there. This is what other probiotics are compared against. Very effectively, I shouldn't say effectively, but very widely researched in a lot of the journals out there. This is actually from the Pediatrics Journal in 2008, that this particular strain, this is obviously for children, is reducing the duration of respiratory tract infections. Just a probiotic, rather than an inhaler and steroids and everything else that somebody might be put on. Another one that was in the World Journal of Gastroenterology, looking at basically that balance between lactobacillus and bifidus bacteria and helping to get rid of H. pylori bacteria. Cinnamon also helping because of that prebiotic factor. I just like adding this stuff up here because this, like I say, it's not from the Journal of Clinical Nutrition. It's out there for others to read. I mean, I have heard some pediatricians, I should say, you know, no, probiotics are useless. Gosh, that was from your journal. It wasn't even from like the Journal of American Medicine. It was from the Pediatric Journal to help. We talked about the prebiotics. I'm not going to go through all that. Vitamin D. Every time you hear me talk, you will hear me talk about vitamin D. Another reason why vitamin D is beneficial, it helps to bring that tight junction together. So those cells, it helps to heal them and close that leaky gut back up. So another reason why vitamin D is important, again, research-based, not just reading it on Wikipedia. Okay, so GI, vitamin D being helpful, yes.
What is the level that is good for vitamin D?
Personally,
For like a female?
5,000 units.
I mean, when they do the blood test.
Oh, when they do the blood test. Your blood test should always be, this is functional medicine, not your lab reports. Functional medicine minimally always looks at 50 and above. 50 and above. 50 is the bare minimum. Your lab results typically run from 30 to 80, depending on the lab. Some labs even run lower. So 50 and above. Depending on what's going on with you will depend on where I actually want the level for somebody. Somebody with an autoimmune process, I want to see 80. Yeah, 50 is the bare minimum. And needless to say, well, we did see some sunshine today. But was anybody bathing in it? Right? Not really. Anything above the 37th parallel line, so basically anything above, really it's truly anything above Florida, but that 37th is kind of right around like that North Carolina area. Anything north of that, we don't stand a chance. We just don't get the sun exposure that we should, and then when we do, we put sunscreen on. So we block our vitamin D absorption. So we're just walking around very low numbers. I see a lot of people single digits when they do their labs. My lowest was a 7 that I saw. I mean, that's just horrible. Vitamin D will do a lot. Helping the immune system, helping that tight junction to really help with infections. Did you have another?
How much should you take this supplement?
Very minimal, I do 5,000. But depending on how low somebody is, you might go 10 or 15,000, short period of time. If you're getting sick, 10, 15,000.
Doctors only got me at 2.
Yeah,
And over the counter.
yeah. Is it D3? By the way, when you take D3, not D2, you want D3. That's the form that the body utilizes. The prescription, there's a prescription vitamin D. Has everybody heard of that? That's a D2 version. And it's in 50,000 units one time a week. And I have a few problems with it. It's vitamin D2, which is not really what the body utilizes, so the numbers go up very slowly. It's one time a week, which is like drink all your water one time a week and you'll be fine. It doesn't make sense. We should be exposed to it all the time. Yes?
What would make the vitamin D not go up the level even if you took a supplement?
Poor absorption from the gut. If your D's not going up, chances are other things aren't going up too. By the way, vitamin D, it's fat soluble, so you've got to have it with a fat-containing meal. A lot of people take this on an empty stomach. Oh, yeah, oh. Vitamin D, right. Vitamin D is a fat-soluble vitamin. Therefore, the only way you're going to absorb it is in the presence of fat. So you need to eat it, you need to have it when you're eating something that contains fat. And guess what? If you don't have your gallbladder, you're not going to absorb fat really well, including vitamin D and the other fat-soluble vitamins like E, A, and K. Oh, oops. So D3, and also what I say with that too is just, and again, I hear just all kinds of crazy stuff out there, but that 5,000 units a day is way too much. Oh, that's toxic. Your nutritionist doesn't know what she's talking about. You shouldn't be on that. Anybody can help me with this. If you were to take 5,000 units times 7 days in a week, what do you come up with? 35,000, right? That's what I came up with too, which is 15,000 less than they give in the prescription dose. So how am I being toxic to somebody? Right? I mean, last time I checked. So, you know, the idea that 5,000 is way too much is really just a misconception.
What's the result of taking too much?
Taking too much, you can get into, well, some issues with the bones and some toxicity issues that go on. But when I'm saying taking too much, it's really been researched that you have to be in the hundreds of thousands of units per day for it to become toxic. I don't know, people are afraid. Your actual level. Yeah, no, nobody's walking around with levels high enough. Yeah, yeah. To actually get your blood levels up high enough, it takes some time. Ultimately, what it comes down to is that vitamin D is good for the gut, yes. It's good for the immune system, yes. It's good for your brain, it's good for your hormones. It is good for everything in your body. Every cell in your body will utilize vitamin D. 3 is the absorbable. D has to be converted, and the conversion rate is very poor. So, right. Yeah, it really is. Yeah, it's very, people don't get their numbers raised.
I don't want to say nowhere, but I mean like 7 to 11.
Yeah, no, it's,
3 years.
yeah. Well, I don't see it that bad, but I don't see it good.
Until they took a true D3.
Right. Completely different. So D3 you need, high doses you need. Very rare. Everybody should know that number. Most doctors are testing for that now, so you should know that number. But if you're not absorbing it well, then it's a few things. Did you take it with a fat-containing meal? Do you have your gallbladder? And what's the rest of your absorption like? Because if your gut is messed up, you're not going to absorb vitamin D just like you're not absorbing a lot of other things. Right? So it's all about healing the gut. Do you see why you fix the gut and you fix a lot of other things? It's a neat process. Yes?
About the gallbladder, I was told that it was just a storage vessel.
Of course you were.
The liver made
It does. It does. The liver does make the bile, and it's stored in the gallbladder for release upon eating. So now instead of having extra storage, now your liver has to make it on demand. So it can be released when eating instead of being ready to go. So if they told you that you would never be able to digest fats again, do you think you would have had it out?
as much pain as I was in.
Okay. A lot of people would sing a different tune. A lot of people have it out and still don't feel better. I see that more often than not.
No, I was very, very sick.
Yeah. And listen, there's certain situations out there, you know, certain situations, but a lot of times it can be avoided. But yes, it is the storage of bile, and the liver does produce it. However, that storage allows that when you're eating, it is released to aid in that at the appropriate time, rather than being made and having to release it at the appropriate time. So,
If I hadn't let it go for 4 or 5 years, then I
Right.
wouldn't have been in that crisis situation.
yeah. Yeah, we need it. It's a needed one. Just like women, really, you do need your ovaries. Whether you want to have a baby or not, you need them. We love taking things out of the body, like, oh, you're done making babies. You don't need those anymore. Yeah, you do. That estrogen's kind of important for cardiovascular health. Please don't take them out at 35 years old. The next phase, the 4th phase, is the repairing stage. So we talk about removal, which is that typically the dietary side of it. The replacing, if you need some digestive enzymes or acid. The reinoculating, which is your probiotics and prebiotics. And then the repair. The repair is essentially sealing up that intestinal wall. This is really kind of creating the barrier. It's like putting a Band-Aid on so your gut can heal without being insulted. So it's like taking a big Band-Aid and sticking it through your whole intestinal tract. And this is very dependent on a lot of different factors. But given the right environment, I'm talking about GI repair in is about an 8 to 12 week time period. And now people are walking around with gut dysfunction for quite a long time. But this is very dependent on some certain factors, things like zinc. Zinc somewhere, as we talked about, zinc carnosine, when we talk about the esophagus, but also the whole intestinal lining. Somewhere between 15 and 30 milligrams a day. Aloe. Does anybody tried aloe? Aloe juice? on your hands because it's healing, right?
Yeah, so I just squirt it down my mouth.
Yeah. Well, you use aloe for a repairing of your skin. So use it for repairing of your mucosal lining, right? That's why it works.
Make sure it's drinkable.
Yeah, you gotta make sure it's drinkable. Yeah. Yeah.
My salad too, right?
Yeah, yeah. So aloe is very healing in that fashion. You know, it's used a lot. I can remember being a kid, my mother had an aloe plant and I got a burn. And she would like, oh, go to the aloe plant. I'm like, really? This is what we're supposed to do? And she'd rub aloe all over, you know. Hey, who knew? It is very healing from that perspective. About 6 ounces a day. Aloe juice is very easy to find now. Some are more pleasant to drink than others. But very easy. I mean, I see it in Price Chopper and everywhere now. It used to be quite a specialty. DGL is deglycerized licorice, is what DGL is. This is a powerful healer. About 200 milligrams 3 times a day. You're going to find this in a powdered form, typically. So deglycerized licorice. Glutamine is an amino acid, also very powerful at the restoring. 10 to 40 grams a day. Your antioxidants all vary, but your antioxidants, you think about your vitamin E and C and A. All of those antioxidants are important. And then fish oil, EPA, DHA, between 2 and 4 grams a day. So be careful with the fish oil. There's a lot of fish oils out there that are very low dose. And that is why they're very inexpensive, because the dose is super low. I can't make this up. She was just in my office before I left here. She goes, but I really like these fish oils. Yours are too big. So I looked at them. Okay, well, I know why they're smaller. She needed to take 12 of them to equal the 2 that I was giving her, because the dose was so low, hence why they were really tiny. So, of course, it was easier to take than a bigger soft gel. But they're not all the same, so you really have to pay attention to labels to get to that 2 to 4 grams a day. That's a lot. So those are some of the, really when it comes to the repairing part, you're going to find supplementation. This is going to be a little bit more difficult on food alone to really get that proper. But I'm telling you, about 8 to 12 weeks, give the proper environment. This is my personal fundamentals. Very basic when it comes to GI health. Ultraflora Plus or Ultraflora IB is the probiotic that I use. That is the actual one that is that gold standard that I talked about, that Lactobacillus NCFM strain. That is what Ultraflora Plus and Ultraflora IB are made up of. The difference between them is regular Ultraflora Plus is 15 billion organisms, which is that baseline, and Ultraflora IB is 60 billion. And the IB, as you can imagine, stands for the IBS syndrome. And this really came as a default. A gastro doctor realized that you needed 4 Ultraflora to really get the relief, so the company made Ultraflora IB and condensed it to that 60 billion. So I use that quite extensively. Endofin is your prebiotics. Endofin is a powdered formula that has some of those fibers that we talked about, the inulin. It actually is flavored with cinnamon, so it's actually a very pleasant tasting powder to help with the prebiotics. And then vitamin D. Very minimal, 1 to 2,000. I really do like the 5,000 units for most people. So this is kind of the base. If you want to go very minimal along with your elimination diet, a good probiotic, a good prebiotic, and vitamin D. Yes?
What brand do you use?
These I use Metagenics. I use a variety of things, but these are all Metagenics. Of course, obviously going along with the rest of the program. So just to recap, the removal process, the elimination diet, start with food. Replacing, if you need to, I don't typically go out of the gate with this. What I typically do is have somebody, if they don't have an ulcer, test their HCl. I send them home to complete that test and see how they do. Reinoculate, you do the prebiotic, probiotic, and the repair. I will tell you I have a great formula that includes all of this, aptly named GI Revive, because it has everything in it that you need. GI Revive. And a lot of times, from that perspective, supplements really, it just helps from the standpoint, it's hard to get all of that in sometimes, especially if you're dealing with issues. But then the fifth R is also important. We have to talk about the fifth R, which functional medicine has really added on, which is about the rebalancing phase. This comes into lifestyle. It comes into stress management. It comes into exercising. And it comes into your thought process. This is the hardest step for everybody. A lot of people will go through the first four, maybe even complaining a little bit about the diet. They'll take the supplements, but when you ask them about stress, they're still flying high. Okay, so there's the lifestyle factors that we really need to take some time for to really allow the body to rebalance. Stress management is greatly needed in our society. Greatly needed. We're all walking around with stress. The bottom line is it's never going to disappear, but how you deal with situations can change, right? So that thought process, having a positive mental attitude, all of these things, some people find it foo-foo, like, you know, motivational quotes of the day or things like that. You need reminders in this world because we are bombarded with a lot of bad things. I personally am not a news watcher. I find it much too depressing, much too sad, much too irritating. My boyfriend, on the other hand, is, I mean, I don't know. He knows more about everything going on because he'll read every paper, watch the news, do all that. Did you hear this? Did you hear that? No, I don't want to hear about what kid got killed today. I just don't need to. I don't need that in my life, you know. So really finding some balance there. This step takes a long time. The other parts, 8 to 12 weeks. You'll be feeling pretty good. This step takes quite a bit of practice. So it's finding some time, carving out some time. And again, it's a whole nother class. I do a whole class on stress management for that reason. There's an old saying, it's not what you're eating, it's what's eating you. Anybody hear that one before? So sometimes it has nothing to do with those 4 steps. And it has everything to do with some emotional or stressful situations that are going on that are literally eating away at you and causing some symptoms to appear. So from the elimination diet, again, just as an overview, what you're eliminating is all grains. You're getting rid of all sugars except for honey, in particular like raw local. You're getting rid of soy and peanuts, animal dairy, yes? Peanuts are very toxic. As you probably know, a lot of kids are allergic to them, hence why, you know, there's that whole idea of what goes on in school there. But there's a toxin that forms on peanuts that can't get killed. And this is what causes the allergy. It's a toxic mold. So they're highly allergic for many people and cause a lot of issues for that reason. Dairy, and when I'm talking about dairy, I'm talking about animal dairy. So your cow's milk, and anything made from cow's milk. You can substitute this with things like coconut milk or almond milk, rice milk, and this is readily available now. I mean, even 3 years ago when I was talking about this, it was difficult to find. You actually could only find almond milk in the containers over in some hidden area, and now it's, you know, readily available just in the regular dairy aisle. Matter of fact, I'm not sure that it's caught on quite yet in Utica, but while I was in New York City, I even see that almond milk is now making a yogurt. So I've already asked the Hannafords, please get this in. But just like coconut milk, they make a yogurt as well. So you can get some different alternatives there. Chocolate and alcohol you're avoiding. And starchy vegetables, you want to do some limitation, if not avoid them completely, because of the sugar content to them. Bad bacteria feeds off of sugar. So if you have intense cravings for sugar, there can be a lot of reasons, but one of them can be a bad bacteria overgrowth because they feed off sugar. So they tell your body, remember, it's really the bugs that are controlling us. It really is. And so they're saying, I need to live. I want food. And so crave that chocolate because I really want that. Some other foods that you should eat are the fermented foods. And these are some of the fermented foods just to focus in on. Things like sauerkraut. Anything pickled, like pickles, or pickled ginger. Miso and tempeh are good options. Olives. Kefir. These are all fermented foods, and they help in the digestion process in terms of probiotic and prebiotics. Yeah.
The yogurt is dairy.
If you go with a non-dairy, so like the coconut-based, if you went with an almond-based, or in reality, what they're really talking about here is you make your own. It's making your own yogurt. Can we see? So these are some of the fermented foods, yes?
I just want to make a comment. I noticed that they have kefir and a lot of sugar.
They do. They do. When we're talking about these, it's the plain Janes.
Even I looked at plain yogurt, they had like 12 grams of sugar.
Yeah.
Or something like that.
Yeah, yogurts aren't my favorite foods out there. I mean, in terms of depending on what's going on with somebody. Sometimes this is the one thing that it's like, oh, please don't take that away too. Because it serves as an easy snack, especially with the Greek yogurts having higher protein values to them as well. So it varies a little bit for everybody, and it depends on what stage you're in. I have some people who come in that are absolute walking disasters, and that elimination diet gets even stricter. And then I have some people that it's, I had one today that's just, it's really indigestion, that's it. Nothing else is showing up anywhere. Yes, we're doing elimination diet, but we got a little leeway in there. We're doing reintroduction a little earlier. So everybody's a little different with that. Yes?
What's in buttermilk?
Butter and milk. It will be animal-based. All butter is animal-based. Yep. So that's typically gone. You use the oils instead. Yes?
So, what about like sodium?
Mm-hmm.
All those would be high in sodium.
Yep. Not too high that you can't handle it. The body needs sodium. Don't forget the body needs sodium. We have this preconceived notion that all sodium is bad. You do need sodium. It plays a big role in a lot of things like balancing fluid regulation and all of that. Now, obviously, as you're eating these things, I'm not asking you to eat a can of pickles, right? Have a pickle. Sodium level in that is fine. And don't forget everything else that you're eating on that elimination diet. Oh, you've eliminated a lot of sodium, I'll tell you that, with cutting out processed foods. So you're getting very minimal doses through the other foods. So not enough to overdo it. I mean, if hypertension is an issue, then don't go for it. That's all, if you're concerned from that fashion. But fermented foods really help in the pro and prebiotic arena. So they're encouraged, yes?
Do we get enough iodine in our diet? I heard
We don't.
No, because we stopped using salt. Right, we stopped using iodized salt. So a lot of people do not get enough iodine in the diet. Your two main sources really are salt and seafood, especially shellfish. So, people aren't eating a lot of that. And we've replaced regular old iodized salt with sea salt that takes the iodine out of it. And it does actually even say on the bottle, this iodine has been removed and it's an essential nutrient or, something along those lines to give you that warning like, hey, just so you know. So lightly salting food is a good thing for the iodine. Again, I think a lot of times, people get afraid of salt because of the hypertension issue. And when we're talking about having too much sodium, it is primarily coming from the processed foods. Make your own soup. If you looked at the sodium content of canned soup, nobody should ever eat that. Like it should really be just pulled from the shelves. It's a sin, really. But when you're lightly salting your food for some flavor, that's fine. Your blood pressure is not going up from a little bit of salt for flavoring. Absolutely not. So use regular old iodized salt. A lot of sea salts are now putting the iodine back in. And big connections there with thyroid concerns. We're open for questions. I'm very proud of myself. I got 15 minutes left. Yes?
What do you suggest for people who've been diagnosed with motility issues, low motility? One time I was told I had gastroparesis.
Okay. Do you feel that that's the case, or were you just told that? Okay. Okay.
But they told me I had always been told to eat fiber.
Right.
Now I've been told no.
Not to eat fiber?
Well, very little. My system can't digest a lot of fiber at one time, and that's
Maybe it's not because of the hydrochloric acid issue, or maybe the digestive enzymes. So maybe you're not breaking it down, but fiber would be the best way for the motility issues. So I would say fiber. Yep. And make sure that you're following up with water.
How much fiber?
You should have at least 25 grams a day. It is a lot of fiber. It is a lot of fiber. One of your sheets is also fiber facts in your handouts. And you can see even when picking different foods. So we all know that fruits are a good source of fiber, as an example. But if you were to look at the top, which I think is raspberries, I can't remember if it's raspberries or blackberries. One of the berries is the top one. And it's got somewhere around 8 grams of fiber per serving. Raspberries. Versus cherries at the bottom at like 3 grams or something, right? So just in picking your fruits can make a big difference. If you have raspberries over cherries, you get an automatic 5 extra grams of fiber right there. Picking lentils over black beans is more fiber. So sometimes it's about picking the right foods to get that fiber intake. So that sheet's there for that reason. So you can just see the variations even within those food groups on where fiber falls. But 25 grams is substantial, and it has to be followed by water. You have to have 8 glasses of water a day. Otherwise, you're going to have some of those symptoms like bloating and constipation as a result of having too much fiber. So then they'll tell you, don't eat so much fiber. Right?
Is there such a thing as slow motility?
Yes. Yep.
I mean, I was tested for it, and they did tell me that,
Yep. Yep, they told you right.
but not the fiber part.
No, the fiber you need.
Yeah, see, and I was told by 2 different.
Yeah. Well, you might not be breaking things down properly. And that might be really the issue. So you're not going to utilize fiber just like you're not going to use your other nutrients. Yep. Yes.
Did you say it takes like 7 years to diagnose?
Yes.
Even if you got tested, but myself, I got tested and it was, you don't have it.
Mm-hmm.
I was on a gluten-free diet and I felt so much better.
Mm-hmm.
So,
So the average time frame for celiac diagnosis is between 7 and 10 years. Because it takes time for the intestines to wear down. You are not going to get a positive celiac test until the intestine has been destroyed.
so I should go on the gluten-free
Absolutely.
just for my own
Everybody should,
feeling better.
in my opinion. Everybody should try. Here's the thing. This is what I put out there last time, and I'll put it out there again. Everybody try for 2 weeks. If nothing else, try a gluten-free diet for 2 weeks and see how you feel. If you want to be real experimental, try the elimination diet for 2 weeks and see how you feel. See what improvements are taking place. It's the easiest test in the world. The best test for a food intolerance is to remove it and reintroduce it. That is better than any blood test, any prick test, any kind of test that you want to do out there for a food allergy. You take it away and you reintroduce it and pay attention to how you feel. If you take gluten away for 2 weeks and then you eat it and you're immediately bloated or get a headache or your energy drops or anything like that, it's not your friend. I don't care what any test tells you. That's your body's way of saying, I don't agree with you. So yes, gluten-free is a big one when it comes to gut health, for sure, and a lot of other things. Yes. Yes. Yeah. You can have genetics done for it to tell if you're genetically susceptible, and we can do that in New York State if your doctor does genetic testing. And again, just because, now I have celiac in my family, my uncle has celiac disease, so I was tested for it, I had my son tested for it, I wanted to know, is it the genetic factor? I don't have a genetic predisposition to it. Okay, good. For some people they'd be like, woohoo, I'm going crazy. I still don't feel good when I eat gluten, so I just don't do it. I don't care, the genetics aren't there, I don't have celiac, but I don't feel really well with it. I feel much better off of it. So that's what I do. I listen to the body. So there is the genetic side, but yes, a blood test. They can do scopes too to look and see what your intestinal wall is like, but it's very common to have it done and say, no, you don't have celiac, so go ahead and eat gluten. And then you keep adding insult to injury, and then it's 7 years later and they go, ooh, you have celiac now. Because we allowed insult to keep, being added there.
They never even bring it up, though, about the type of test. The doctor never brings it up.
In what, terms of the genetics?
Just say, she tested for it.
Yeah. Yeah, I don't make friends. I don't make friends because usually I'll tell you to go out and get all these tests and they'll be like, where did you hear this from? These are some things you should know. I mean, it's out there and it's worth knowing. Even the genetic tests. There's not a lot of genetic tests that can be done in New York State, but the celiac panel is one of them. You can see, do you have the genes? Are you susceptible? And if you are, boy, oh boy, you better get preventative now. I mean, you've got the red flag that your genes are susceptible to it. So if you keep adding gluten to your environment, your genes will express and you will develop that celiac disease. So it's out there. You can do it. Questions? Yeah.
Why is there a push for sea salt now?
For what?
Sea salt.
Sea salt? Why was there a push? I was part of the mineral content to it. I think a lot of people felt that the sea salt was the better option over the table salt from the sodium scare and high blood pressure and that. But there are a lot more minerals associated to sea salt or Himalayan salts, and so you get more trace minerals from that perspective. So from an overall mineral aspect, you're getting more from it. But you're losing one of the very key things that salt is really there for, which is the iodine. So you get everything else and lose the iodine. But you can, as I said, now a lot of the sea salts are adding the iodine back in, so that would be the way to go. Because you can get a lot of your trace minerals through it.
Now you personally, on a gluten-free diet, you never eat bread of any sort?
Very rare. Very rare. And I'm telling you, I'm coming from an Italian family, an Italian-Polish family at that. Bread, are you kidding me? Like, you know, you sleep with it. Oh, my loaf of bread. I mean, that's just what you did, right? And yes, initially it kind of seemed like the end of the world, but I don't even think about it anymore. It just doesn't interest me anymore. And part of that comes down to the fact I don't feel well with it. So I just, you know, I look at it and it's kind of like, well, I could have that and then I could be bloated. I'll go without it. There's a lot of foods out there you can eat without bread. A lot of people will be like, well, what am I going to have for lunch? Soup, salad, your leftovers from the night before, a stew. I mean, there's a lot you can have without bread. Nobody said that lunch could only be a sandwich. So, yeah, bread's really just, you know, it's going to pop up here and there, but, and there's a lot of options now. I personally don't think the gluten-free breads are great. So, just forego it. Yeah. Just forego it. Have something else. Have rice. Yeah. Yeah. I mean, ultimately, bread is, you know, now what's happened is we've labeled breads, too, as like a whole grain bread, right? No, the whole grain is the grain in its whole form. That's what a whole grain is. That's the grains that we should be eating. Because bread, ultimately, still, the grain has been taken, it's been processed, it's been heated, it's been, you know, things added, things taken away, and we form it into this thing that we call bread. It's not a real food. Bread doesn't grow anywhere, right? I mean, we have to make it. We have to grind things down and take it away from the actual whole source that it is. What the body will respond very favorably to is the whole grain. The rice, the quinoa, the oat, the millet, the whatever it is, the actual grain itself that has not been mushed down into a flour to be made into a bread. Oh. Okay, so they're grinding down the beans, yeah. Yep. Yep. You know, they're looking for all kinds of alternatives now to the gluten-free craze. And I always warn people too, when you're going gluten-free, it doesn't mean you go on this craze. Usually I let clients do this because I know it's going to happen and it's kind of fun from the perspective that they're like, oh, I'm going gluten-free. And, you know, I went here, there, and wherever, and I found these gluten-free crackers, and I found these gluten-free cookies, and and they go on this gluten-free overload. And I'm like, so, how are your vegetables? Oh, yeah, I forgot about those. Right? So they go on this little gluten-free kick, and okay, get it out of your system. But now what it really comes down to is gluten-free really essentially means, you know, you have a little bit of rice here and there, or quinoa, or, you know, gluten-free oats. That's it. You really, I actually see a lot of people end up going grain-free completely. No grains at all. And guess what? You live. You survive. It becomes actually quite easy. You do a lot of vegetables and have a sweet potato instead of rice at dinner or things like that. Yeah. Whole wheat is gluten. Wheat is gluten. Yeah.
About the regular macaroni.
Gluten. It's processed down to wheat to make it white.
Macaroni, like you said when you were Italian, right?
There's rice pastas out there. Quinoa pasta is out there. You know, so you can do that. Yep, brown rice pasta. That's, And quinoa, I would say the quinoa pasta is more similar to what people associate to pasta. So you have that option. But ultimately, you know, long-term goal is still, it's processed into something. So, you know, it depends on where everybody is. Some people are real sticklers. There's a doctor I work with, she doesn't allow any of that stuff. If it's not the real deal, you don't eat it. You know, and you know, I work with people one-on-one, and I know there's limitations for everybody, but ultimately one of the goals is eating whole foods. It means the real deal stuff. And I promise you, you will not be deprived. Really, you will be quite satisfied, and there are a lot of foods out there that are real foods. You know, they're walking around, they're swimming around, they're growing in plants, they're growing in gardens, they're growing on trees. All of your nuts, all of those things that are really very satisfying to the body because it's giving you all the nutrients that you need to live healthy. The cravings disappear. When you get rid of the junk, the cravings will disappear for it. I promise you, they do. Sugar cravings, the easiest way to get rid of sugar cravings is to avoid it for 3 days. It'll be gone. That 3 days just might be torture for you. But it will disappear that quickly. So it's, you know, a lot of adjustments. You do little things along the way. But at a very minimum, I would just ask all of you, try gluten-free for 2 weeks and see how you do. See how you feel. See how your digestion is. See how your bowel movements are. Are you bloated? You know, and go from there. Now next week we're talking about gluten. The whole class is gluten. Yeah. The whole class is gluten. So we will be diving in a lot deeper into all of the connections to gluten and different diseases. I have no clue. You got to call MV. Yeah. They just tell me before I come here.
Another question about seltzer water.
Yes.
You said it reduces the acid.
Any carbonation. Yep.
So if you have high acidic stomach, you should, what if you don't have I drink a tremendous amount of seltzer water.
Chances are you have very low acidic stomach then, because the carbonation has destroyed the acidity. It's destroyed that. So chances are, that would be my educated guess, is that you're not making enough stomach acid because of the carbonation. So you got to be careful with that. It can help to relieve some symptoms. That's how, like, you know, you get a bellyache, and what did Mom used to give you? Ginger ale. Because ginger, the concept is there, ginger is calming on the digestive system, and the carbonation, that's why you got ginger ale and not Coca-Cola. Right, right. It was, back in the day, it was the real ginger stuff. Every once in a while you can find them, and it's very different taste than, you know, Canadian dry or whatever it is, right? Canada, yeah. See how far I am from the soda world. Any other questions? Yeah. It's not the wrong kind of omegas. It does have omegas in it, but it does have 3s and 6s to it. And the conversion, flax, very good for a lot of reasons, but there's a conversion process that has to take place. So flax, just to give you an example, EPA and DHA are the 2 omega-3s that are wildly beneficial. This is what's found in fish oil. Fish oil often is described and marketed as EPA, DHA. Flax has to convert into EPA and DHA. So when you're eating flax and it's rich in omega-3s, which it is, there's a conversion process that has to take place to get to the actual usable form. So it's, I don't want to say horrible, but it's lower than just having fish or fish oil. You'll be a little bit better off with flax oil. The conversion's a little bit easier because the digestion process is easier. But flax does have omega-6s in it as well, which as a culture we typically are too high in. So it's not that it's the wrong kind, and in reality, if that's where you're getting your omega-6s from, go for it. That's not a problem. We do need omega-6s, it's just typically as a culture we have too many of them, and not enough of the 3s. So it's not that it's wrong. Yep, good question though.
What's the best way to get vitamin B12?
Animal meat, if not supplement. Vegetarians are usually deficient in B12 because the best sources is animal meat.
But we need it though.
Yes, absolutely. That's why if you're vegetarian, you should typically supplement for B12. Yep.
What did you say it was digested again, vitamin B12?
Most of your B's in the stomach. There's a thing called intrinsic factor that's in the stomach, and that's what's needed for B12 absorption. And when we cut it off in the stomach, then you don't absorb B12.
It's only in beef?
No, animal. It's primarily animal. You're going to get B12 and a few other things, but to get to the doses that you need, it's animal meat.
You better off taking a supplement?
If you're vegetarian, yes. Or if you're not eating animal meat, then yes. Yep, very common deficiency in vegetarians and vegans.
Can you get it in chicken or not?
Yeah, yeah, any animal meat. Poultries, anything, yep.
The ileum?
Mhm.
I was told that's where it was,
The ileum's the small intestine.
oh, it is.
Yep, that's in the small intestine, and that's where most nutrient absorption is taking place.
It's like one small part of the small intestine?
It's still pretty big. Yeah, about 20 feet long, yeah,
Okay,
yeah.
then I understand.
But if the intrinsic factor isn't there for B12, then you're certainly not absorbing it. So it's really starting in the stomach. Intrinsic factor is needed for B12 transportation and absorption. So if that's not there because there's no stomach acid, then the B12 is not going to get absorbed anywhere, including in the ileum. Most of your nutrients are absorbed in the small intestine. That's what those little villi are there for. That's what they're grabbing, is all the nutrients. Looked confused. It's a lot of information. Listen, this is a hot topic, and this stuff isn't talked about. I have had many gastroenterologists tell my clients, nutrition has nothing to do with this. That is not going to help you. The young girl that I'm working with now, I say young, she's early 30s, ulcerative colitis, was diagnosed about 5 years ago with it, is quite sick of being on the steroids and this drug and that drug, and said there's got to be something else. There's got to be a better way. I can't live like this forever. And so she sought me out and came in. We went through a very aggressive, with ulcerative colitis, a very aggressive 4-hour program. All the supplements, she got a very strict elimination diet, needed to really clean things up. And she had called me 9 days later after she went to her doctors and told them how great she was feeling. He said it had nothing to do with the diet. She was just in remission. Not kidding, can't make this stuff up. She goes, I don't think so. I think it has everything to do with what I've changed and took things out, and I feel way better in 9 days. It has nothing to do with the diet. He wanted to give her another medication. She says, I'm good. I'm good right now. I want to see what happens. Since then, she's actually reduced her medication. But diet has nothing to do with it.
Don't you think it's like if she was in Europe?
Oh, totally different.
I know.
Please, it'd be totally different. Get outside of the U.S. and treatments are completely different.
And I think they're better sometimes
Yeah.
when you think about it.
Yeah, totally different there. Lifestyle, in most European countries, Australia and that, you don't get a drug until you're on a lifestyle program for 12 weeks. No drugs are prescribed until you change your diet and lifestyle factors first. Then, if you can't manage it, you might get a drug. Maybe, not always, maybe. We really have it wrong here. Yes?
Instead of taking Prilosec, I know you've already said it, can you repeat what you said? Something about it causes vitamin D deficiency?
Yes, because of the intrinsic factor that we were talking about, it cuts off the ability. Intrinsic factor is what's needed to help in the transportation and aid of absorption of B12. And proton pump inhibitors all inhibit the intrinsic factor as well. So a lot of times with supplements too, you'll see B12 with intrinsic factor added because that is what's needed. It propels the absorption and transportation of it. So PPIs cut off that intrinsic factor, therefore your B12 has no way, it has no It has no car to get somewhere. So it's going to affect your B12 levels and cause deficiencies. You heal the gut. Yeah, you need to heal the gut. You start with the elimination diet. You've got to allow that healing to take place. And even that removal process in terms of, do you really need it? You know, it might be an issue of checking your hydrochloric acid and really seeing, do you really need it? Because the symptoms of hyper and hypochlorhydria are the same. So a lot of people can really get off those and be fine. I'm not suggesting you do that, though, because I'm not a doctor and I can't tell you to stop taking them. Thank you. Apple cider vinegar can be beneficial, yes. Yep. Mm-hmm. Yep.
You could do that instead of like the pickles and the.
Uh-huh. Yep. Just really quick, everybody has their little feedback forms. Thank you. Thank you. Yes, thanks. Please feel free to provide feedback. This is how I came up with 3 new classes this time around. So if there's classes that you're interested in having or anything like that, I mean, I just constantly revise this stuff all the time. So feel free to provide that feedback. And hopefully I'll see everybody next week when we talk more about gluten for a whole 2.5 hours.